Another day, another video of first aid by. Can exhaustion cause fever? Causes, symptoms and treatment. First aid by. It is possible for exhaustion to cause a fever, although it is not common. When someone is dealing with extreme fatigue, they can become more susceptible to illnesses and infections as their immune system is weakened. In some cases, this can lead to a fever if the body is unable to fight off the infection. It is important to pay attention to your body and seek medical attention if you experience a fever from exhaustion. Exhaustion itself does not cause a fever. However, exhaustion can be a symptom of an underlying condition that can cause a fever. In this video, we will discuss some common causes of fever and exhaustion, their symptoms, and treatment options. Causes of fever and exhaustion. Infections. Yes, exhaustion can cause fever. When the body is under physical or emotional stress, the immune system can become weakened, leaving it more vulnerable to infection. This can lead to an increased risk of contracting viruses or bacteria, which in turn can cause a fever. It is important to get plenty of rest and proper nutrition to help maintain a strong immune system and reduce the risk of infection. If a fever develops, seek medical advice to determine the cause and get treatment if necessary. Autoimmune disorders. Autoimmune disorders are a group of diseases that occur when the body's immune system attacks its own cells and organs. This can lead to a wide range of symptoms, including fatigue, pain, and fever. In some cases, exhaustion can be a cause of fever. When the body is exhausted, it is unable to fight off infection as effectively, and this can lead to a rise in body temperature. In addition, exhaustion can also lead to a weakened immune system, making it harder for the body to fight off infection. If you experience a fever along with exhaustion, it is important to seek medical attention to determine the cause. Cancer. Cancer and its treatments can cause extreme exhaustion, which can in turn lead to a fever. Because cancer treatments can often be taxing on the body, it is important to take extra precaution to ensure that you are getting adequate rest and nutrition. If you are feeling exhausted, it is important to pay attention to your body and take the time to rest and recharge. If symptoms such as a fever persist, it is important to speak to your doctor as soon as possible to determine the cause and begin treatment. Additionally, staying hydrated and eating healthy can help to minimize the risk of feeling exhausted and developing a fever. Medications. Exhaustion can cause a type of fever known as a fatigue fever. This is not the same as a traditional fever caused by infection, but rather a reaction to the body being pushed beyond its limits. A fatigue fever is usually accompanied by body aches and pains, chills, and fatigue. It can also be accompanied by other symptoms such as confusion, headache, or digestive upset. If exhaustion is the cause of the fever, then rest and fluids are the best treatment. Medications may be used to help control the fever if necessary, but should not be used until the underlying cause is identified and treated. Symptoms of fever and exhaustion. The symptoms of fever and exhaustion can vary depending on the underlying condition, but some common symptoms include high body temperature, fever. Exhaustion can be a contributing factor to a high body temperature or fever. When the body is under a lot of stress, it can cause the body to become overheated. This can lead to an increase in the body temperature, which is referred to as a fever. Additionally, exhaustion can weaken the immune system and make the body more vulnerable to infections that can also cause fever. If you are feeling tired and have a fever, it is important to speak to your doctor to determine the cause. Fatigue. Fatigue is a common symptom of many illnesses, including the flu and the common cold. It can be caused by a variety of factors, such as lack of sleep, stress, or an underlying medical condition. In some cases, fatigue can lead to exhaustion, which is a state of extreme physical or mental exhaustion. Exhaustion can cause a wide range of symptoms, including a fever. Although a fever is a sign of an underlying illness, it can sometimes be caused by exhaustion. A fever caused by exhaustion usually disappears when the person gets enough rest and drinks plenty of fluids. However, if the fever persists, it may be a sign of an underlying medical condition and should be checked by a doctor. Weakness. Weakness and exhaustion can be signs of an underlying medical condition, such as an infection. If a person is feeling weak and exhausted, they may also experience a fever. A fever is a sign of the body's attempt to fight off the infection, so it is important to seek medical attention if a fever is present. People experiencing weakness and exhaustion should also contact their doctor to ensure that they do not have an underlying medical condition that needs to be treated. Body aches. Exhaustion can be a sign that the body is struggling to cope with a physical or mental demand, and in some cases, it can lead to a fever. Symptoms of exhaustion can include body aches, fatigue, and difficulty concentrating. If exhaustion is accompanied by a fever, it is important to seek medical attention to identify the cause. Factors such as a virus, infection, or underlying medical condition can all be causes of a fever. Treatment may involve rest, hydration, and medication, depending on the cause of the fever. Additionally, it is important to practice good self-care habits such as getting enough sleep, eating a balanced diet, and exercising regularly to reduce the risk of exhaustion and fever. Chills. Exhaustion can cause a fever in some cases, as the body's immune system becomes weakened due to lack of rest. Other symptoms associated with exhaustion-induced fever can include chills, headaches, body aches, sore throat, and fatigue. It is important to note that exhaustion can also lead to other illnesses, such as the flu or cold, so it is important to seek medical help if the fever persists. Additionally, dehydration can also be a factor in causing a fever, so it is important to stay hydrated when feeling fatigued. Sweating. Exhaustion can cause a number of different symptoms, including fever. Sweating is often one of the first signs of exhaustion and can be a signal that your body is overworked and overwhelmed. If you are feeling unusually tired and are sweating more than usual, it is important to take steps to get rest and take a break from whatever is causing the exhaustion. Fever can also be a result of exhaustion and can be a sign of serious illness. If you are experiencing a fever along with exhaustion, it is important to seek medical treatment immediately. Headache. Headache and exhaustion can be symptoms of a fever illness, such as the flu. When a person has a fever, their body temperature rises above the normal range that is considered healthy. A fever can be caused by a variety of different illnesses, but it is important to note that exhaustion and headache can be signs of a fever. If someone is experiencing these symptoms along with a fever, they should seek medical attention right away to determine the cause. Nausea. Nausea and exhaustion can cause fever in some cases. When a person is exhausted, their body is put under strain and their immune system can become weakened. This can lead to the body being more susceptible to infection and disease, which can cause fever. Additionally, exhaustion can also lead to nausea, which can further reduce the body's ability to fight off infection. It is important for people to get adequate rest and take steps to reduce their fatigue in order to help prevent fever. Treatment for fever and exhaustion. The treatment for fever and exhaustion will depend on the underlying cause. Some common treatments include rest. Treatment for exhaustion-related fever can vary depending on the severity of the symptoms. Rest is the most important treatment for exhaustion-related fever, as it allows the body to recover from fatigue and regain its energy. Additionally, over-the-counter medications such as ibuprofen can help reduce the fever, while fluids can help rehydrate the body and help flush out toxins. If the fever persists, it is important to seek medical attention to diagnose and treat the underlying cause of exhaustion and fever. Hydration. Treatment for exhaustion and fever typically involves hydration, rest, and over-the-counter medications. It is important to ensure that a person drinks plenty of fluids to stay hydrated. This may include water, sports drinks, or electrolyte-rich beverages. Rest is also important for recovery, and a person should aim to sleep for at least 7 to 8 hours per night. Over-the-counter medications, such as ibuprofen, Advil, or acetaminophen, Tylenol, may help reduce fever and manage any pain or discomfort. It is important to speak to a doctor before taking any medication, as some can have side effects. Medications. Treatment for exhaustion can include medications to reduce fever, improve sleep, and increase energy. Depending on the potential cause, medications may include antihistamines, steroids, or muscle relaxants. For example, antihistamines can be used to reduce inflammation and provide some relief of fever and fatigue. Steroids can be used to reduce inflammation and improve energy levels. Muscle relaxants can be prescribed to reduce the severity of fatigue and improve sleep. Additionally, lifestyle changes such as increasing exercise, eating a balanced diet, and managing stress can help with fatigue, as can getting plenty of rest. Antibiotics. Treatment for exhaustion causing fever depends on the underlying cause. Antibiotics may be prescribed to treat bacterial infections, while antiviral drugs may be used to treat viral infections. Non-infectious causes of fever, such as certain autoimmune conditions, may require anti-inflammatory medications or other treatments. It is important to consult a medical professional to determine the cause and receive the appropriate treatment. In some cases, rest and fluids may be sufficient to help reduce fever and improve fatigue. Immunosuppressive therapy. Immunosuppressive therapy may be used to treat autoimmune disorders. Chemotherapy. Chemotherapy may be used to treat cancer. If you are experiencing fever and exhaustion, it is essential to see a healthcare provider for an accurate diagnosis and appropriate treatment. In conclusion, exhaustion can lead to a variety of physical and mental health issues, including fever. This is because exhaustion can weaken the immune system, reducing its ability to fight off infections. Additionally, exhaustion may make it difficult to get adequate rest and nutrition, which can further weaken the immune system and make it more susceptible to illnesses. Therefore, it is important to get enough rest and practice good self-care to prevent exhaustion and the potential health risks that come with it. Thanks for watching.